Hello guys. So now we shall be discussing regarding the spermatic cord. Okay. So our topic of discussion would be regarding the spermatic cord. So what did I tell you? What is spermatic cord? Spermatic cord is nothing but the collection of nerves, collection of arteries, veins, muscles, ducts, all of them together you call it as a spermatic cord. So first of all, you need to know from where this spermatic cord is formed. This spermatic cord, you know, in the inguinal region we have got two canals, right? For example, if this is your inguinal canal, okay, this inguinal canal is having two rings. So one ring here and another ring here. So the ring which is on the top is called as deep inguinal ring, okay, deep inguinal ring. So the ring which is on the bottom is called as superficial inguinal ring, superficial inguinal ring, deep inguinal ring, another one is called as your superficial inguinal ring. Now coming to the spermatic cord, spermatic cord is formed by this deep inguinal ring. Spermatic cord is formed by deep inguinal ring. Okay, it is formed by deep inguinal ring, and this spermatic cord will exit. Okay, this will exit from where? This will exit from the superficial inguinal ring. Superficial inguinal ring, and it will exit into where? It will exit into your scrotum. Superficial inguinal ring, and it will exit into your scrotum, right? If you look at the picture, you will understand. Let me put up the picture over here so that it would be better understandable. So this particular structure over here, you can see this is your spermatic cord, right? So here you can very clearly see in this picture that you see this structure that is coming down, right? So this particular structure is called as your spermatic cord. Okay, let me use another color. So this particular structure which is coming down is called as your spermatic cord. Now you see from where this spermatic cord is coming. There is a ring over here. You see a ring like this. This ring is called superficial inguinal ring, and there is a ring inside also. You see there is a ring inside. This ring over here is called as deep inguinal ring. Deep inguinal ring, and this ring over here is called as your superficial inguinal ring. Superficial inguinal ring, right? If I am zooming this inside, you can see many rings here. Here you have got a ring, here you have got a ring, you see here you have got a ring, and here also you have got a ring. So all these structures, you see the veins, the nerves, right, the artery behind, all of them are entering into a ring, and finally they are exiting out like this, you see, right? So this is what is called as your spermatic cord over here, right? Now the next important thing, look at another picture also. So this would be much more better clear for you. So this ring which you can see over here is called as your superficial inguinal ring. Now from this superficial inguinal ring, your spermatic cord is coming and it is entering into what? It is exiting into your scrotal sac. Okay. Now if you look at what are the different layers that are present surrounding your testis, right? So that is one of the very important thing which you have to discuss over here. So this is nothing but called as the fascial coverings. This is nothing but called as a fascial covering. So what are the different kinds of fascial coverings which we have got? So the first important thing you need to know that in the center over here you have got the testis. Okay, this layer particularly, this structure over here is called as testis. On the top of the testis you have got another important structure. This structure is called as your epididymis, right? This is called as your epididymis. Now what I am telling you is that from the abdominal cavity, right, from the abdominal cavity you see a muscle that is coming, a fascia that is coming like this. This particular fascia is called as transversalis fascia. Now this transversalis fascia is surrounding the testis, right, and this transversalis fascia later on it will become internal spermatic fascia. Okay, so here in the abdominal cavity this fascia is called as transversalis fascia. I will just write it as TF, later I will write in detail. So this TF, transversalis fascia, once after surrounding your testis, this would transform into internal spermatic fascia. Okay, what is this? It is transforming into internal spermatic fascia. Now the testis is attached all the way down here with the help of this particular structure called as G. G stands for what? G stands for gubernaculum. Okay, so it is surrounded with, it is attached down to us with a structure called as G, that is called as a connective tissue called as gubernaculum. Right. Next important thing is that you have got another muscle over here. So this is the second important muscle. You see, this muscle over here is called as your internal oblique muscle. Now next important thing is that you have got another muscle over here. So this particular muscle over here is called as your internal oblique muscle. Okay, so what is this particular muscle over here? So this muscle is called as your internal oblique muscle. Now this internal oblique muscle, internal oblique muscle, by the time it enters into your testis, this internal oblique muscle is transformed into cremasteric muscle, CM. Okay, so it is transformed into your cremasteric muscle as well as your fascia. So this particular muscle over here is your internal oblique where? In the abdomen. So the muscle which is internal oblique in the abdomen is hanging down all the way to the testis and surrounding the testis. Once it surrounds the testis, you call this muscle as cremasteric muscle. Okay. Next, after internal oblique, you should also have external oblique muscle. Let us say that this particular muscle over here which I am drawing right now is external oblique muscle. So this external oblique muscle which is coming all the way like this, right, is transforming as external spermatic fascia. So one you had was internal oblique, now whatever I am drawing is external oblique. So external oblique surrounds the testis and it transforms itself as external spermatic fascia. Okay. So how many fascias you have got over here? One is called as internal spermatic fascia, another one is called as external spermatic fascia, and the third one over here is called as cremasteric muscle as well as fascia. Cremasteric muscle as well as your fascia. Okay. So what are the things here? The things are, let me write it down. So this is called as your transversalis fascia. Transversalis fascia is converting into what? Internal spermatic fascia. Internal spermatic fascia. Okay. Next, internal oblique. What is this? IO in the sense internal oblique. Internal oblique is transforming into what? It is transforming into cremasteric muscle and fascia. Okay, cremasteric muscle and fascia. And finally, the last important thing you have got, what is this important thing? This is called as your external oblique muscle. So this is your external oblique muscle, right? External oblique muscle is transforming into what? External spermatic fascia. External spermatic fascia. So these are the layers which you need to know, which are surrounding the testis, right? Now if you look, what are the contents of the spermatic cord? What are the important contents of the spermatic cord, guys? Coming to the contents of the spermatic cord, so you should know few important things. That let us say if I am making a section of spermatic cord, what will be the outermost layer of the spermatic cord called as? So this outermost layer of spermatic cord is called as external spermatic fascia. After external spermatic fascia, what is the next fascia you have got? You have got is the cremasteric muscle and fascia, and after that you have got the internal spermatic fascia. So let me also draw the internal spermatic fascia over here. So this is your internal spermatic fascia. Now between the external and internal spermatic fascia, this particular structure which I am drawing right now is nothing but called as your, what is this? This is your cremasteric muscle. So this is your cremasteric muscle as well as your fascia. So here you have got few important structures. One is called as external spermatic fascia. Okay, and next over here you have got is the internal spermatic fascia, external spermatic fascia, internal spermatic fascia, and the center one you have got is the cremasteric muscle and fascia. Cremasteric muscle as well as the fascia, right? Now, in the center of the spermatic cord, what are the contents you have got? First important content is the artery. Okay, so here we have got an artery. What is the name of this artery? This is called as an artery to ductus deferens. What is the name of this? This is an artery to ductus deferens. So this is an artery to ductus deferens. Now after that, you have got one more artery over here. What is the name of this artery over here? The name of this artery, right? The name of this artery over here would be testicular artery. So this is your testicular artery. Testicular artery. Next, what is the artery that is present here within the cremasteric muscle as well as the fascia? This artery is called as cremasteric artery. So this artery over here is called as your cremasteric artery. So what are the different arteries we have got? One is called as the artery to ductus deferens, another one is called as your testicular artery, and the third one over here is called as your cremasteric artery, right? Now after this, the next important thing is that where is ductus deferens here? So this particular structure over here which you can see, right? So this particular structure over here is called as ductus deferens. Now after this ductus deferens, where are the nerves? You told me that this particular, see, let us say this is one of the nerve. You told me that spermatic cord, in the sense it contains arteries, veins, ducts and all of these things, right? So where are the nerves? So this is the nerve over here. What is this nerve? This is the genital branch of genitofemoral nerve. Okay, so this will be your genital branch of genitofemoral nerve. So this is the genital branch of your genitofemoral nerve. Next important thing is that coming to this, you even have got some veins over here. You see, there are some veins over here. So all these veins together, they join and form what? All these veins together, they join and form Pampiniform plexus. So that is why you call them as veins of Pampiniform plexus. Veins of Pampiniform plexus. So if I ask you what are the contents that are present, now apart from this, you even have got lymph vessels also. So here let me draw these vessels and tell that these are the lymph vessels. So what are the contents of the spermatic cord? What are the contents of the spermatic cord? One you have is your ductus deferens. Ductus deferens is one content. Next there is artery to ductus deferens, and after that you have got the genital branch of the genitofemoral nerve. Next you have got the testicular artery, lymph vessels, right, cremasteric artery and veins of the Pampiniform plexus. So these are the structures, or these are the contents of the spermatic cord, right? And next important thing is that look at this particular picture. You would understand one very important thing over here, that you see an artery is entering. You see, this is an artery that is entering into the testis. Now surrounding this artery, this plexus of veins, whatever is there, so these plexus of veins is called as your Pampiniform plexus. Pampiniform plexus. Actually, what is this plexus doing? So this artery is bringing blood to the testis, and veins are taking, this plexus, Pampiniform plexus is taking blood from the testis, right? All the blood within the testis is drained into your Pampiniform plexus. So the temperature, if you see, the temperature within this artery, let us say this is a testicular artery. The temperature within this testicular artery is high, and the temperature within the Pampiniform plexus is low. So arterial blood is coming down, venous blood is going up. As this movement is happening, the high temperature, so this is a high temperature blood and this is a low temperature blood. So what is happening is that this high temperature blood is exchanged with the low temperature blood like this. Okay, so what is this happening? What is this? This high temperature blood is exchanged with the low temperature blood. So as this exchange is happening over here, that is the reason why the testis is maintained under a normal temperature, right? And next important thing, where are these veins draining, is that you see the Pampiniform plexus on the right side. Pampiniform plexus on the right side directly drains into the right testicular vein, and right testicular vein directly drains into your inferior vena cava. Whereas the left side, left testicular vein is draining into where? It is draining into this particular structure called as left renal vein. So this is your left renal vein. Okay, this is your left renal vein. So right testicular vein is draining into where? It is draining into inferior vena cava, and the left testicular vein is draining into the left renal vein over here. Okay, so this is one of the very important thing which you need to know. So these are all some of the important things which you need to know regarding the spermatic cord, guys. So thank you so much for watching my video. Goodbye.